Hi, my name is Pauline Isabel Centeno from BSN 2A, and today I will demonstrating the abdomen and musculoskeletal assessment. So the materials needed for this one is the stethoscope and notepad and pen. So for assessment, we need to identify the client first. So we can ask the name of the client. So what is your name, sir?
Centeno.
Okay, sir. Thank you. So this is to avoid medical errors and to confirm if the procedure is appropriate to the client. So next one is we need to explain and discuss how the client can cooperate. So sir, so all you need to do is to follow my instruction. So don't be nervous, and I will guide you in all procedures. So is that okay, sir?
Yes.
Okay, sir. Thank you. So this is to lessen anxiety and gain cooperation of the client. So we will now proceed in planning. So for planning, we need to perform hand hygiene. So this is to avoid transmission of microorganisms and to prevent illness. So next one is we need to provide privacy. So we can close the door and curtains to provide respect, enhance autonomy, prevent economic harm, discrimination, and embarrassment, and to avoid distractions from external noises. So for this one, we need to ask the client to lay down the bed, sir. Can you lay down? Okay, sir. Thank you. So we will ask the client to pull his shirt up. So sir, can you pull your shirt up? So okay, sir. Thank you. So the first implementation for this one is to inspect the abdomen for skin integrity. So as we can see, it has a uniform color. There is unblemished skin. There is no presence of rash and lesion, and there is no tense and glistening of skin. There is no evidence of purple CA, that indication for Cushing disease, which is endocrine disease that increase the growth of pituitary gland. So if we see any surgical scars to the patient, we need to take note for the size. So if it is 2 inches or 5 inches, so we will know for the location of scars, if it is in the upper right corner and or quadrant or the lower right quadrant, and we will look for its color. So as you can see, it is normal. So next one, we need to inspect for abdomen, for contour and symmetry. So upon inspecting the abdomen of the patient, so it has a flat, so rounded. There is no evidence of enlargement of liver. So as we inspect in the upper right quadrant, and there is no enlargement of spleen on the upper left quadrant. So it has also a symmetric contour and no appearance of bulges or marked ridges. So if there is an observed abnormality, so upon inspecting, so we can measure the abdominal girth of the patient using our tape measure. So next one is we need to inspect the abdominal movements associated in respiration, peristalsis, or aortic pulsation. So upon inspecting the respiration, so we will ask the client to take a deep breath. So sir, can you take a deep breath? So if you notice the abdomen follow the inhalation and exhalation of the patient, there must be a symmetric movement in the left and the right side of the abdomen during the inhalation and exhalation. So there is no signs of pain. So we can assess the respiration of the patient. So sir, can you deep breath? So inhale and exhale. So okay, sir. One more, inhale and exhale. So okay, sir. So thank you. So as you can see, there is a symmetric movement caused by respiration. So So we will now proceed for peristalsis movement. So upon expecting this, we will have or notice there is a normal movement of the GI tract of the patient. So we will now first inspect the ascending colon from lower right to the upper right quadrant, and then to the transverse colon, to the right upper to the left upper quadrant. So for the descending colon, so upper left to the lower left quadrant. So as you can see, so since the patient is thin, there is a visible peristalsis, and in aortic pulsation, we will now ask the client to take a deep breath. So sir, can you take a deep breath? Okay, sir. Then, okay, 1, 2, 3, inhale and exhale. So can you hold your breath for a second? So as you can see, there is a pulsation in the epigastric area, which is normal. So the abnormal findings for this one, if there is a pain observed, and there is an observed visible peristalsis in fat clients that indicates bowel obstruction. So if there is a marked aortic pulsation or too strong pulsation in epigastric area. So next one is we need to proceed in inspecting for presence of vascular pattern in the abdomen. So as we inspect there is no vascular pattern, so it is normal. So next one, we need to auscultate the abdomen for bowel sounds, so vascular sounds and peritoneal friction rubs. So in this one, we need to use our stethoscope. Before using it, we need to warm the stethoscope. So next one is we need to auscultate the abdomen. Before that, we can ask the client, so what is the last food he ate? So because the sounds can relate to the state of digestion or presence of food in the GI tract. So, sir, what is the last eat? What food did you eat?
Egg.
Okay, sir. Thank you. So we will now place the diaphragm of the stethoscope in each of 4 quadrants of abdomen. So we will now first auscultate the aorta port in the middle, here at the cycloid area. So we will now proceed to the renal arteries to the right, to the left renal artery. So on the left iliac artery, okay, so in the right iliac artery, so go down to the right femoral artery, and then go down to the left femoral artery. So upon auscultation, there is audible bowel sounds, and there is an absence of arterial root, and there is an absence of friction rubs. So the abnormal findings for this one, if we observe any root over aortic area or renal or iliac artery. So if there is an friction rub caused by enlargement of tumor or mass. So next one, we will now perform palpation, depalpation in all 4 quadrants. We will just need to do light palpation, so in all 4 quadrants. So we will now proceed in the left lower quadrant. So light palpation to the left upper quadrant, and then go to the upper right quadrant, and the right lower quadrant. So we will now have deep palpation. So we will now start in left lower quadrant. So sir, tell me if you feel any pain. Okay sir, thank you. So next one on the deep palpation in the left upper quadrant. Okay. So on the right upper quadrant, so just tell me sir if you feel anything pain. So deep palpation last in the right lower quadrant. So as you can see, there is no tenderness noted, and there is a smooth and constant tension, and there is a tender in the typhoid process and sigmoid colon, which is normal. So I don't see any masses and hypersensitivity in the abdominal of the patient. So next one, we will now palpate for an enlargement of liver and spleen. So in this one, we will now palpating the upper right quadrant of the abdomen of the patient to inspect the liver. So there is no enlargement of liver and the border feels smooth. We will now proceed in the left upper quadrant to feel the spleen. So as we palpate, there is the border is smooth and there is no enlargement of spleen. So next one is we will now ask the patient to empty his bladder, and the next procedure we will now palpate the area of the pubic symphysis if the client indicates possible urinary retention. So we will now palpating the bladder. So upon palpating, so it is not palpable, the bladder. So the normal findings for this one is that it is distended and it is palpable and has a dense mass. So next one is we will now percuss the areas in each 4 quadrants in tympani and sounds. So we will now begin on the left lower quadrant. So on the left lower quadrant, on the upper right quadrant, on the upper left quadrant, and on the lower left quadrant. So as we percuss, and there is a tympani over the stomach, and there is a dullness sound in the liver and spleen or a full bladder. So the abnormal findings for this one is when there is a large dull areas, so that indicates presence of tumor in the area. So after that, we will now proceed for musculoskeletal assessment. So for this one, we need to inspect muscle for size, presence of contractures, and tremors. So on this one, we will now compare each muscle on one side of the body to the same muscle to the other side. So on this one, we can use the measuring tape to measure the muscles if we observe any discrepancies. So as you can see in the upper part of the body of the patient. So there is an equal size of muscles in both sides. And the lower part, it is also an equal. And there is no also contractures or observed tremors in the muscles of the patient. So the abnormal findings for this one is if there is an atrophy or decrease in size of muscles, hypertrophy in increased size of muscles, and malposition of body parts, or foot drop or foot legs forward, and if there is a presence of tremors. So I don't see anything, so we can consider it normal. So next one is we will now palpate muscles at the rest to determine the tonicity. So we will now palpate upper arm of the patient and the lower part, the legs. So as we palpate, so it is normally firm, so it is normal. So next one, we will now palpate muscles when client is active or passive in placidity, smoothness, or of movement. So as we palpate the muscles when the client is active, can you move your hand? So there is a smooth coordinated muscle movement. So if the client is passive, so there is a smooth coordinated of muscles. So I don't see any placidity, weakness, or spasticity, or sudden involuntary muscle contraction, and there is no tremors observed. So next one is we will now palpate muscle or client. We will now test the muscle strength. So we will compare to the right side and the left side of the patient. So in this one, we can ask the patient to stand up. So you can stand up and raise your arm forward. So thank you. So while doing it, we will put our arm and push it down. So the patient must fight the strength and get full resistance. So sir, upon pushing it, so you must resist the strength I will put. Okay? So, sir. Okay, sir, thank you. So as we can see, there is an equal strength on each body side. So I will give it 5 since there is a normal strength and normal full movement against gravity and resistance. So next one is we now assess the bones. So we will inspect the skeleton for normal structure and deformities. So we will now ask the client to straight forward. So sir, can you straight forward? Okay. And then as you can see, there is no deformities in the skeleton and the bones are not misaligned. So we will now palpate the bones for edema. To the upper body and to the so as you can see, there is no tenderness or swelling, so it is normal. So we will now assess the joints. So first we need to inspect for the location, color, and swelling or muscles. So in the joint, we will now assess for ball, socket, and socket joint in the shoulder. So upon inspecting, there is no swelling on the elbow and the hinge joint. swelling on the wrist or the saddle joint. There is no also swelling on both sides, and there on the neck or the swivel joint. There is no also swelling, and on the fingers, the ellipsoidal joint, there is no also presence of swelling. So we will now palpate for any tenderness, repetition, and presence of nodules. We will now palpate first the swivel joint on the neck. So I don't feel any tenderness. So next one is shoulder, the ball and socket joint. So we palpate the elbow, the hinge joint. On the wrist, saddle joint. And in the fingers, so upon palpating, I don't feel any tenderness, swelling, or nodules presence in the client. So next one is we will now assess joint range of motion, ROM. So we will now ask the client to move selected body parts. So if it is available, so we can use goniometer to measure the angle of the joint. So we can ask the client to flexion his elbow, sir, both sides, extension, okay, underneath. So flexion, extension, hyperextension. So another fixer. So flexion, extension, hyperextension. Okay. Thank you. So on the neck, so rotation. So rotate your head on the left side, middle, the right side. Okay, sir. So on the wrist, sir. So radial deviation and ulnar deviation. So thoracic. So we will now assess the thoracic and cervical spine. We will now observe for symmetry, tenderness, and presence of pain. So we can ask the client to stand up. So we will now ask the client to bend forward. Can you bend forward, sir? So we will look for the alignment of skull and check for its scoliosis. We will check for the C7 to the buttocks. So it is in alignment, and in the shoulder is even. So as we observe, there is symmetrical and no tenderness or nodules and no signs of pain. So next one is we will now perform ranges of motion of the thoracic and lumbar spine. We can ask the client to bend forward, flexion, extension, sir, straight, hyperextension, okay, sir, and rotate to the right, to the left, okay, bend to the right, sir, like this one, and bend to the left, sir, okay. So as you can see, there is a various range of motion, and there is no presence of pain upon doing the ranges of motion. So the patient do all ROM effectively, so it is normal. So next one is we will now observe the shoulder and arms for symmetry, swelling, color, and masses. So as we observe the shoulder and arms, it is symmetrical, so uniform in color, no swelling or masses present, and there is no also deformities present. So it is normal. Next one, we will now perform ROM, so of the shoulder. So in this one, we need to flexion, extension, hyperextension. Okay. Abduction, reduction. Cross arm flexor. So as the client to touch her neck, reach down the scapula like this one. So okay, sir. External rotation, internal rotation. Okay, so we will do it on the other side. So to determine the hinges. So in this one, we can say that the client has a normal findings because he moved his shoulder without any pain. So next one, we will now observe for elbow size, shape, deformities, redness, or swelling. So as you can see, so there is a symmetric, uniform color of elbows, and there is no deformities or masses. So it is normal. So next one, we will now palpate for olecranon process and epicondyles in relax and flex position. So we will now palpate olecranon process or at the tip of the elbow in relaxed position. So palpate the medial and lateral and observe for any pain and tenderness. So in flex position, palpate the olecranon process, the medial and lateral epicondyles. So upon palpating, so it is not palpable and there is no signs of pain, there is no swelling and there is no masses present and there is no tenderness or redness. So next one, we will now perform the range of motion of elbows. We will now ask the client to flex his elbow, extension. So supination. So we will do the other side. So as we can see that the client can do the ROM of the elbow without any pain. So it is normal. So next one is we will now inspect and palpate for size, shape, and symmetry of color and swelling, and we will now palpate for tenderness and nodules of the wrist. So we will now inspect, palpate the wrist. So there is no tenderness and there is no presence of nodules. So the patient don't feel any pain and there is now also deformities. So next one is we will now perform the range of motion of the wrist of the client. So we will now ask the client to flexion, wrist extension, so flexion, extension, hyperextension, so radial deviation and polar deviation. Understand? Flexion, extension, hyperextension, radial deviation, and polar deviation. So, okay, sir. Thank you. So, as you can see, the patient don't feel any pain and there is can able to move the wrist without any pain. So it is normal. So next one is we now inspect for size, shape, symmetry, color, and swelling of hands, fingers, and metacarpophalangeal joint. So as we inspect, there is a uniform color, no swelling and no masses and redness. So we will now palpate for tenderness of bony prominences, nodules of interphalangeal joint. So as we palpate the interphalangeal joint, so there is no tenderness and there is no repetition or nodule. So there is no signs of pain and there is no tenderness. So we can consider it normal. So next one, we will now perform ROM of hands and fingers. So sir, can you abduct the hands? Okay. So abduction. So okay sir, flexion, hyperextension, palm away from fingers, both sides sir. Thumb touching the small finger. So as you can see, the patient able to the range of motion without any pain, and it is not limited, so it is normal. So next one, we will now inspect and palpate for shape, symmetry, tenderness, the hip. So we will now ask the client to lay down again at the bed. Certainly lay down. We will now ask the client to turn. So turn side sir. Palpate at the back. So on the back. So there is uniform color, no swelling, and there is no nodule, so it is normal. So we will now perform ROM of the hips. So we will now ask the client to remain laid down, and we will now do flexion of the hips, extension. So roll down to do the hyperextension. So sir, can you take this one? One only sir. Yan. Yan. Okay, to the other side. So to the other side sir. So abduction, like this one. Abduction. So the cross leg. Okay sir. So lay down sir. Knee flex sir, like this one. Points towards the body, abduction and adduction away from the body. Okay? We will now do internal rotation and external rotation. So internal sir, like this one, and external. So we will do the both sides and monitor or notice if there is a symmetry of. So we will now, next one we will now ask the client to so we will now inspect the knees for symmetry, size, color of the knees. So sir, can you sit down? Okay sir, thank you. So we will now inspect the knees of the client. So there is a symmetrical, uniform in color, and there is no signs of swelling or redness. So it is normal. So next one, we will now palpate for tenderness, warm consistency, and nodules. So as we palpate, so we can ask the client if you feel any pain. So do you feel any pain, sir? So we will now palpate the medial part and the lateral sides and feel the knee gap above and down and the center. So we will now ask the client to stand up. So sir, can you stand up? And we will now palpate the back of the knee. So as we palpate, there is no signs of tenderness and nodules that I observed. So we will now both sides and compare the two. So next one, we will now perform the range of motion of the knees. So for the knees, we will now ask the client to sit down and then flexion, sir, like this one, extension, hyperextension. So abduction, adduction. So we will now ask the client to walk. So sir, can you walk a little bit? So at least 5 steps. So as you can see, the patient do effectively the ROM and it is normal. So next one, we will now perform ROM of the ankles and feet. So sir, can you dorsiflexion, plantar flexion, inversion and inversion. Okay sir. So abduction, adduction. So we will do the both sides and compare the two. So on this one, we can say the client has a normal findings and because didn't feel any pain and do effectively the ROM exercises. So for evaluation, we need to evaluate if the physical assessment is within the normal range and we use to determine if the nursing orders are needed to change or it is completed. So for documentation, we will document and report significant findings of in our nursing notes to provide reflection in nursing assessment. So thank you.